Hi, Jenny. As promised, here you are. Can you have lymphedema in your pannus if you are obese? Absolutely. I see it a lot. Um, First, for people out there, what is a pannus? A pannus is the part of the stomach that hangs down real low, and it causes a lot of problem. And I've made a few videos on it. That weight is significant. It also leads to further lymphatic issues in the legs because of the weight of it sitting on the inguinal lymph nodes and those vessels closes it. That's not your question. Let's get to your question. How or what are my suggestions on how to manage this? Compression, right? Complete decongestive therapy is about compression and moving that fluid. Breaking up that fibrotic fluid is part of what we want to do to get it to remove. How do I know it's fibrotic? You told on yourself. Orange peeling look. That is classic, the orange peel texture. If you think of if you look at the skin of an orange, that's kind of what it looks like. Not in color, but the texture of it. And that is really dense. My guess is if you were to push your thumb into that orange peel and take your thumb off, there's going to be an indentation of your thumb, which means it's pitting. And that fluid is also very thick, and we need to break that up to get it out. This area of the body is very complicated. A therapist could do some manual techniques, but as far as short stretch bandaging, perhaps, but it's a really hard thing to get on to stay on. So what are some suggestions? So my first suggestion is typically a biker short that you could get at an athletic store. But I recently came across a new product. I don't even know if it's new. To me, it's new, from Sigvaris called Comfrey Shorts. I don't know why they call them shorts because they're capri, but that's my own hang up. But these are compressive, and these are about 15 millimeters of mercury of compression. And if you are bandaging or you do have compression in your lower legs, you could layer your compression. You could put this over your normal compression stockings. And what that's going to do is it's going to come up well over that pannus up to here, and that's going to provide you with some compression. Does it fit you? Great question. I don't know the answer to that because I don't know who you are other than Jenny from Lily Facebook group. But here, let me get out of the way. Here are the sizes. Go ahead and screenshot that. You could also find these sizes on Sigvaris's website. This product is not too terribly expensive, so if you had to pay out of pocket, I think it would probably be worth it. One, because it's sized much more appropriately. We know what the compression is. When you go to a sporting goods store, you're kind of like, trying to figure it out, which is what I've been telling people for years to do. But now I'm actually guiding them to Sigvaris for these capris. What can you do with them? Because by itself, is that enough? Probably not. Not in your situation and not in most people's situation. So what else can you add to this? You have to think outside of the box. When it comes to lymphedema treatment and management, your therapist can't be, it's like this, it's like this. It doesn't work because everybody's different, and we have to approach it in an artful way with our skilled and researched clinical understanding, if that made any sense. So I would layer this. How would I do that? Well, I already talked about layering compression on the lower legs, but what would I do for this part, which is your main concern according to this question? I'm going to show you two products that I think would be helpful. The one is over my head by Haydenham, which is their Comfy Wave. This is for an arm, but you can see that it's textured. My understanding is it's super comfortable. They do make this in custom sizes. So if you could get a custom made to help with that area and put that underneath the Sigvaris or whatever else you're going to wear, those capris that's going to come up to here, this is going to add some texture into that area to help break up that fibrotic tissue and start helping to move that fluid as it gets softer. Super stretchy. This has never been washed. I assume that if you wash this, this actually gets to be pretty soft and comfortable. This is not cheap. I get that. Money is always a factor. So, is there a cheaper option? Perhaps. Let's talk about another product, Mobiderm. Mobiderm. This is a very soft foam, and what I would encourage a patient to do with something like this And if it's not this, you could easily make something like this with foam and stockinette. So there's solutions. Again, you have to think outside of the box with the principles. So if we have the capris on, then we take something like this or something like this and we put that underneath. And what that's going to do is that's going to give more compression. Also, because it's designed to help break up fibrotic tissue, that's what it's going to do. So it's going to help start to reduce that. Now here's the thing, as you reduce, you also want to reduce in size with your compression, because otherwise it's just going to keep filling up. You must reduce and use compression to maintain. Compression will help for sure, but when you're actively using your pump, or something like these two things, that's going to help reduce further. And then those capris, the shorts, which it throws me off every time, compris shape. Well, I was wrong the whole time. Matt, I was wrong. See, it's okay to admit you're wrong when you're wrong. I don't know why I kept seeing compris shorts. I guess that's how my brain filled it in. Compris shape makes a lot more sense. And I've been wondering about this for a long time. Ooh, what does Oprah say? Aha moment? I guess I just had one. Look, the point is if you get some sort of compression capri, and then you can start adding things to help break that up. I hope that helps answer your question. There's a lot of different products and there's a lot of different strategies. Hopefully this just helps get your wheel turning to find a solution that works for you.